Who is your time right now? Online influencer Jessica Pettway recently died of cervical cancer after a misdiagnosis. A doctor had originally diagnosed her with fibroids until months later, he told her that she actually had stage 3 cervical cancer. She died 9 months later. MedStar Washington Hospital Center Gynecologic Oncologist Dr. Ebony Hoskins joining us now to break down the difference between the two and what you can look out for. Good morning, Dr. Hoskins. Thank you for being with us.
Good morning.
So first and
How are you?
foremost, I'm good. Thank you so much. So how do you differentiate the two, and why do you think that they're confused in some cases?
I think this is a great question. I'm glad that we're talking about it this morning. There are two different diseases. Uterine fibroids are benign or non-cancerous masses in the uterus that, for most of the part, don't necessarily cause symptoms. Sometimes can be heavy bleeding or pelvic pain. Cervical cancer is actually cancer of the cervix and can be prevented really with pap smears and HPV vaccination.
With cervical cancer, we know that over time, the cells can change. Oftentimes,
Right.
some people are asymptomatic and others do experience this. So when it comes to both, what are some symptoms that women should look out for?
Well, I would say overwhelming majority of cervical cancer is diagnosed without symptoms. When I hear that someone has been diagnosed and they have symptoms such as pelvic pain and bleeding, I think advanced disease. Cervical cancer is preventable. Hands down, it's preventable. Pap smear, HPV test, and now we have HPV vaccination. So I think the biggest take-home point is that cervical cancer is preventable.
A very important message there. And then also, too, when it comes to those pap smears, how often should women get them?
I think they should. It changed in most recent years. I would advise that you consult with your gynecologist or primary care provider, but it all depends on risk factors and whether there's HPV virus that's present at the time of a pap smear. So it's very variable, but my encouragement would be to see your GYN provider annually.
When it comes to fibroids, I know some health studies have said on average, I know respondents to one, it took some women an average of 3.5 years to seek treatment. 41% said they had to go through 2 healthcare providers before they got that fibroids diagnosis. Why do you think it's so difficult to just hone in on this and pinpoint the issue early on?
I think in the day of post-COVID healthcare is a little bit harder to navigate. So it's kind of hard to say, but in terms of access, but my encouragement would be if someone is not getting the care they need is to advocate for their health and maybe even seek another opinion.
All right. Thank you so much, Dr. Hoskins, for weighing in on this and giving us some more knowledge about it.
Thank you.